Living with ulcerative colitis can be challenging, but with the right management strategies, you can regain control of your life. In this comprehensive guide, we explore the various aspects of managing ulcerative colitis and how Lialda, a breakthrough medication, can provide significant relief. From understanding the symptoms and triggers to implementing the right diet and lifestyle changes, we leave no stone unturned to help you navigate this condition effectively. Lialda, with its unique formulation, targets the inflammation in the colon and helps to induce and maintain remission in patients with ulcerative colitis. Discover the science behind Lialda's effectiveness and learn about the potential side effects and dosage guidelines. If you or a loved one is struggling with ulcerative colitis, this guide is a must-read for gaining a better understanding of the condition and the role Lialda can play in your journey towards improved health. What is ulcerative colitis? Ulcerative colitis is a chronic inflammatory bowel disease, IBD, that primarily affects the colon and rectum. It is characterized by inflammation and ulcers in the inner lining of the large intestine, leading to symptoms such as abdominal pain, diarrhea, rectal bleeding, and urgency to have bowel movements. The exact cause of ulcerative colitis is unknown, but it is believed to involve an abnormal immune response targeting the gastrointestinal tract. Understanding the challenges of managing ulcerative colitis. Managing ulcerative colitis can be a lifelong endeavor, as it is a chronic condition with periods of flare-ups and remission. Flare-ups can be debilitating and significantly impact a person's quality of life. They can range from mild to severe, with symptoms varying from person to person. It is crucial to work closely with healthcare professionals to develop an individualized management plan that addresses your specific needs and goals. One of the main challenges of managing ulcerative colitis is identifying and avoiding triggers that can worsen symptoms or induce flare-ups. Common triggers include stress, certain foods or drinks, infections, and nonsteroidal anti-inflammatory drugs, NSAIDs. Keeping a symptom diary can help you identify patterns and make necessary adjustments to your lifestyle. Implementing lifestyle changes is another critical aspect of managing ulcerative colitis. Getting regular exercise, managing stress levels, and ensuring adequate sleep can all contribute to better disease control. Additionally, quitting smoking is essential, as it can worsen symptoms and increase the risk of complications. Introducing Lialda, an overview of the medication. Lialda is an FDA-approved medication specifically designed for the treatment of ulcerative colitis. It belongs to a class of drugs known as aminosalicylates, which work by reducing inflammation in the colon. Unlike traditional aminosalicylates that require multiple daily doses, Lialda offers the convenience of once-daily dosing, making it easier for patients to adhere to their treatment regimen. Lialda comes in the form of delayed-release tablets that are designed to release the active ingredient, mesalamine, gradually throughout the colon. This targeted delivery ensures maximum effectiveness in reducing inflammation and promoting healing. How does Lialda work in the treatment of ulcerative colitis? Lialda works by targeting the inflammation in the colon, which is the primary cause of ulcerative colitis symptoms. The active ingredient, mesalamine, is a 5-aminosalicylic acid, 5-ASA, that possesses anti-inflammatory properties. It acts locally on the inflamed tissue, reducing the production of inflammatory chemicals and preventing the migration of immune cells to the affected area. The unique delayed-release formulation of Lialda allows for the gradual release of mesalamine throughout the colon, ensuring sustained therapeutic levels. This targeted approach helps to induce and maintain remission in patients with mild to moderate ulcerative colitis. By reducing inflammation, Lialda can alleviate symptoms such as abdominal pain, diarrhea, and rectal bleeding, allowing patients to experience a better quality of life. The benefits of Lialda for ulcerative colitis patients. Lialda offers several benefits for patients with ulcerative colitis. Firstly, its once-daily dosing regimen simplifies treatment and improves medication adherence. This is particularly important in chronic conditions like ulcerative colitis, where long-term management is necessary. Secondly, Lialda's targeted delivery system ensures that the active ingredient is released in the colon, where it is needed the most. This helps to minimize systemic absorption and reduce the risk of side effects commonly associated with traditional aminosalicylates. Furthermore, Lialda has been shown to be effective in inducing and maintaining remission in clinical studies. It has been found to reduce symptoms and improve the overall quality of life for many patients. By controlling inflammation and promoting healing in the colon, Lialda can help patients achieve long-term disease control and minimize the risk of complications. Lialda versus other treatment options, a comparison. When it comes to the treatment of ulcerative colitis, there are various options available, including other aminosalicylates, corticosteroids, immunomodulators, and biologic therapies. Each option has its own set of advantages and considerations, and the choice of treatment depends on factors such as disease severity, patient preference, and potential side effects. Compared to other aminosalicylates, Lialda offers the advantage of once-daily dosing, which can improve treatment adherence and convenience. Additionally, its targeted delivery system helps to minimize systemic absorption and reduce the risk of side effects commonly associated with other medications in this class. When compared to corticosteroids, Lialda is considered a safer long-term treatment option. Corticosteroids are effective in managing acute flare-ups but are associated with significant side effects when used for an extended period. Lialda, on the other hand, can be used for long-term maintenance therapy without the same level of risks. Immunomodulators and biologic therapies are typically reserved for patients with moderate to severe ulcerative colitis who have not responded adequately to other treatments. While these options can be highly effective, they often come with increased risks and costs. Lialda, as a first-line treatment, provides a more conservative approach with proven efficacy for a significant number of patients. Tips for effectively managing ulcerative colitis with Lialda. Managing ulcerative colitis effectively requires a comprehensive approach that goes beyond medication alone. While Lialda plays a crucial role in controlling inflammation, there are several lifestyle modifications and strategies that can complement its effects. Firstly, it is essential to follow a well-balanced diet that minimizes trigger foods and provides adequate nutrients. This may involve avoiding spicy foods, alcohol, caffeine, and high-fiber foods during flare-ups. However, it is important to consult with a healthcare professional or dietitian to develop an individualized diet plan that suits your specific needs. Secondly, stress management techniques can significantly impact disease control. Stress has been known to trigger flare-ups and worsen symptoms in many patients. Exploring relaxation techniques such as deep breathing exercises, meditation, and yoga can help to reduce stress and promote overall well-being. Regular exercise is also beneficial for ulcerative colitis patients. It helps to improve digestion, reduce inflammation, and enhance mood. However, it is important to find activities that suit your fitness level and avoid excessive exertion during flare-ups. Lastly, staying informed about your condition and having a support network can make a significant difference in managing ulcerative colitis. Joining support groups, seeking counseling, or connecting with others who have similar experiences can provide emotional support and valuable insights. Success stories. Real-life experiences of patients using Lialda. Real-life experiences of patients using Lialda have been overwhelmingly positive. Many individuals have reported significant improvements in their symptoms and overall quality of life after starting Lialda. By effectively managing inflammation and promoting remission, Lialda has allowed these patients to regain control and live fulfilling lives. One patient, Sarah, shares her journey with ulcerative colitis and how Lialda has transformed her life. After struggling with frequent flare-ups and debilitating symptoms, Sarah's healthcare provider prescribed Lialda as part of her treatment plan. Within a few weeks, she noticed a remarkable improvement in her symptoms. The abdominal pain and urgency to have bowel movements significantly decreased, allowing her to resume her daily activities and enjoy a better quality of life. Another patient, John, highlights the convenience and effectiveness of Lialda's once-daily dosing regimen. Prior to starting Lialda, John struggled to remember to take his medication multiple times a day, leading to inconsistent treatment. However, once he switched to Lialda, he found it much easier to stay on track with his medication schedule. This improved adherence has resulted in better symptom control and fewer flare-ups for John. These success stories demonstrate the positive impact that Lialda can have on patients' lives. By effectively managing symptoms and promoting remission, Lialda allows individuals to regain control and live life to the fullest. Important considerations and precautions when taking Lialda. While Lialda is generally well tolerated, it is essential to be aware of potential side effects and follow the prescribed dosage guidelines. Common side effects may include headache, abdominal pain, nausea, and diarrhea. If you experience any severe or persistent side effects, it is important to contact your healthcare provider for further evaluation. It is also important to inform your healthcare provider about any other medications, supplements, or medical conditions you have before starting Lialda. Certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, may interact with Lialda and increase the risk of side effects. Your healthcare provider will be able to provide personalized guidance and ensure that Lialda is the right choice for you. Lastly, it is crucial to attend regular follow-up appointments with your healthcare provider to monitor your progress and make any necessary adjustments to your treatment plan. They can help assess the effectiveness of Lialda and address any concerns or questions you may have. Conclusion: empowering patients with Lialda in their ulcerative colitis journey. Managing ulcerative colitis can be a complex and challenging endeavor, but with the right strategies and support, it is possible to regain control and live a fulfilling life. Lialda, with its unique formulation and targeted delivery system, offers significant relief for patients with ulcerative colitis. By effectively reducing inflammation and promoting remission, Lialda can alleviate symptoms, improve quality of life, and minimize the risk of complications. In this ultimate guide to managing ulcerative colitis, we have explored various aspects of the condition and how Lialda can play a pivotal role in your journey towards improved health. From understanding the challenges of managing ulcerative colitis to implementing lifestyle changes and exploring other treatment options, we have equipped you with the knowledge and tools necessary for effective disease management. Remember, every individual's journey with ulcerative colitis is unique, and finding the right treatment approach may require some trial and error. By working closely with healthcare professionals and staying informed, you can take control of your condition and lead a fulfilling life. Whether you are just starting your ulcerative colitis journey or looking for additional support, Lialda can be a game changer in your quest for long-term disease control and improved well-being. Thanks for watching.